Hello, thank you for joining me for this presentation on feeding a child with food allergy. My name is Alexia Beauregard. I'm a faculty member of the Ellen Satter Institute, and I work for Wynn Army Community Hospital in Fort Stewart, Georgia, as part of the Department of Defense team and the Defense Health Agency. And this presentation is in recognition of Global FPIES Day. So let's talk about some of the challenges with feeding a child with food allergy. I hear a lot from parents, regardless of what's going on with their child. I hear a lot about picky eating. Prevalence of picky eating behaviors have been reported to be as much as 50% in normally developing children. So I think it's safe to say that there is some amount of picky eating that's actually just developmentally appropriate and is considered normal. And we're going to talk about in this presentation what to do if the picky eating becomes harder to manage. Children with a developmental delay may have higher incidence of picky eating. And while we are going to be focusing on FPIES, children that have an eosinophilic gastrointestinal disorder, they have really high rates of picky eating, reported picky eating. So I think we can extrapolate. I think it's safe to say that children with food allergy that have a gastrointestinal manifestation are going to be more likely to have some picky eating tendencies. Picky eating or fussy eating, we're going to say, is consuming a limited variety of food. So it's important that we define what is it that we're talking about. So picky eating, limited variety of food. So feeding difficulties and trying to determine if your child has a feeding difficulty, need to sort out what that means as well. It means it's going to be more of a spectrum of problematic eating behaviors. The child may spit out food. The child may just become irritable and start crying just at the sight of a spoon or a bottle, or just being brought over to a high chair. They may start to really have some problematic behaviors and become really upset and agitated. They may eat very slowly. They may even demonstrate some difficulty swallowing. That could be something about the flavor of the texture of the food that they don't even want to swallow the food. Problematic feeding behaviors in normally developmental children include, again, what we talked about with that picky eating, limited variety of food, poor appetite, excessive fluid intake, refusal of eating solid food. And this could be, when we talk about refusal of eating solid food, this could be the child that is just having a very difficult time transitioning, say, from a puree to something that's chunky, or maybe they're okay with a puree, but they don't like something that's crunchy. And what research has this found? And again, there's not a lot of research in picky eating in children with food allergy. So we have to look at what research exists and then how can we think about applying it to this particular situation with this particular child and family. But what research has pointed out is that the number of problematic feeding behaviors, so the more difficult behaviors that the child demonstrated, the more severe the case is, and the greater the consideration that needs to be taken when working with this child and with the family to resolve these issues and promote food-seeking behavior. Picky eaters, behave well most of the time during meals. Now, we are talking about children. And so sometimes children just have a bad day, as do adults. So sometimes there's just not going to be the best behavior at the table, but by far, picky eaters are going to behave most of the time. They may eat one or two foods on the plate and ignore the others. They may touch or play with the food, but in general, they're not afraid of it. And they just may simply not be ready to put certain foods or flavors or textures in their mouth at this point in time. So a picky eater is somebody that's going to be able to find some food seed on the table, may decide that they want to play with it, but maybe they're just not ready to eat the food. Now, if you have a problematic eater, they're more than likely going to behave poorly at the table. They're going to be very agitated, very fussy. They're going to be very upset at the sight of any new foods or maybe any food for that matter. They may cry, throw their plate, refuse to come to the table at all. And some children may gag the moment they see or smell the foods. So when you're trying to decide where your child fits on this spectrum, I hope some of these slides in really differentiating behaviors, I hope for you as the parent, are going to help you just get a better idea of where your child is and what kind of support you and your child may need. So what are the characteristics of feeding difficulties? Well, some learned maladaptive behaviors. That could be really trying to fill up on fluids as opposed to solid foods. If the child has any kind of developmental differences, that certainly could be contributing to the feeding difficulty. The child has any swallowing difficulties, any oral sensory skill deficits, oral motor skill deficits, those are certainly going to contribute to feeding difficulties. So it's important that you get a full assessment by a healthcare provider that is specially trained in feeding difficulties. So, for example, going to see a speech language pathologist, you want to find one that is trained in feeding difficulties to be able to take a look and be able to differentiate. Is there something with the child's anatomy that is contributing to the feeding difficulty, or is this behavioral in nature? Because that's really what's going to determine the course of the treatment. So how do you know if you have a normal picky eater, if this is, again, developmentally appropriate, or if this is something else going on? Well, if you have the infant or toddler that just will not advance to solid food, so the textures are an issue, they just will not advance textures. Food jags are normal in toddlers and preschoolers, but we're talking about a food jag that lasts for months and months. So what is the food jag? The child that only wants to eat, say, the same 3 or 4 foods. That's normal, but now we're talking about that this is going on for months and months on end. If the child demonstrates fear of new foods, that's certainly something that needs to be investigated. The older child may refuse to expand food choices, they demonstrate increased anxiety around food, and then their growth may even slow. And so in the older child, if we notice that the growth is stagnating, that's definitely worth investigating and taking a really careful look at that growth chart to be able to determine, is it what's going on with the slow growth. So now that we've kind of gotten a better idea of defining what is a picky eater versus problematic eater and those problematic feeding behaviors, and how do you know when something needs to be investigated, what do we do about it as parents, as clinicians? Well, it's important that feeding difficulties be considered as a relational disorder between the feeder and the child. So if a child's a picky eater, it's not the child's problem. It's an issue that needs to be addressed as in the family unit. Parents or caregivers, the feeding style must be incorporated into the management of feeding difficulties. We need to look at just everything that's going on in the home. Is the schedule very chaotic? Do the children have a lot of after-school activities, and could that be contributing to some of what's going on? Is the child not sleeping well? And if the child's dysregulated with sleep, that could cause maybe some dysregulation with food. So we need to start off by looking at the family and what's going on in the context of the family unit. So as a parent, I would like you to think about, what kind of feeder are you? Again, this is not being judgmental. This is, people develop feeding styles for a wide variety of reasons. Certainly, feeding style depends on maybe how you were fed as a child. Was there enough food when you were a child? Not enough food for you when you were a child? So as parents, we bring our own attitudes to adulthood into how we feed our children. So again, I don't want you to feel like that this is being judgmental. It's just that if we're looking at a feeding issue in a child, we need to look at how the parent is feeding the child so we can begin to tease out where we can make some changes and some tweaks so that food becomes fun again. So please think about, authoritative feeders follow a division of responsibility, and we will talk about that in a few minutes. Authoritarian feeders often decide how much the food the child should eat. ignores the child's own hunger and satiety cues, and may use rewards or punishment to get the child to eat. So we may see this, that a child may say that they're full, and the parent says, no, you're not. You need to finish all of the food on your plate. Permissive feeders completely cater to the child and may provide very little structure to meals and snack times. And I see this happening quite often when there's been an issue with food allergy, because food may be limited in general for the child. There's a lot of emotion that goes along with food and goes along with eating and feeding, and understandably so. So some parents may end up in the permissive category because they feel very badly about what's going on with their child, or they're very scared, they're very nervous about what's going on with their child, so they just want their child to eat any food. So they end up catering to the child because they're so concerned about that growth chart and so concerned about their child eating anything. Neglectful feeders may fail to offer food at regular times. They may set time limits as to what food is offered. They may offer developmentally inappropriate foods. They may not sit with their child. They may not engage in conversation. And it's also important to keep in mind that as human beings, we don't necessarily always fit in one of these boxes all day, every day. And then there may be times where we may straddle a couple of these boxes as well. And so that's just something that would just need to be a point of discussion. So as we're investigating the type of picky eater, there are a couple of questions that we need to look at from the feeder's perspective as well as from the child's perspective. So for example, limited appetite. Does the child actually have a limited appetite, or maybe the child grazes all day long? Maybe the child eats a little bit, just enough to cut the hunger all day. And so the child actually doesn't have a limited appetite. They're just not eating a lot at one period in time because they've been allowed to eat small amounts all day long. Or is it more organic in nature? Is the limited appetite because the child has stomach pain or reflux, or maybe is on a medication that influences the child's appetite, or maybe is the child chronically constipated, which is going to influence the appetite? When we look at selective intake, is the child really truly selective in their intake, or maybe are the parents limited in their own variety for whatever reason, or are the parents scared to introduce new food? And so maybe the child actually doesn't have selective intake. It's just that the circumstances being what they are is what's created selective intake. Or do we have a problematic feeder, and the selective intake is more organic in nature, maybe because of how food tastes, or maybe there's a sensory processing issue, so the child is struggling more with different textures and how those textures feel in their mouths. Certainly fear is something that needs to be investigated. A child that chokes, maybe because as they're feeding themselves, they stick their fingers too far back in their throat and they kind of choke and gag, or they choke because maybe they're feeding themselves too quickly. That can be fearful. It can be fearful for a feeder to watch that. It can be fearful for the child to have experienced that. And certainly if a child experiences pain, that absolutely is going to generate fear. And if in a case of FPIES, where it's a situation where there's extensive vomiting or extensive diarrhea that occurs, after a child eats something, that absolutely is going to cause fear. So we need to do some investigation as to what are the specific behaviors that the child is exhibiting. Where are those coming from? And then, of course, we need to look at the feeding style. It's important to point out that the more controlling the feeder is, the greater likelihood that the child's going to be a picky eater. Putting a child in an environment where they're highly controlled and then there's a lot of pressure is going to make picky eating worse. That pressure a lot of times comes from a good place because the parents are so fearful and they want their child to grow and they want their child to eat the food that is presented. But more control is not going to make a child less picky and more willing to eat foods. So we have to remember that eating is a skill that is learned by a child. Feeding is a skill that is learned by parents and caregivers. And then the food allergy can make it more difficult for both parents and children to learn those skills. So let's take a little bit of pressure off of ourselves and remember that when there's a serious medical condition that's going to complicate life, we just have to approach things a little bit differently, and that's okay. So we also need to remember that food allergy is only part of the child and it's not the entire child, and children have to be given the opportunity to meet developmental milestones. There's a critical time period between 7 and 18 months old for the development of oral motor skills and introduction of new tastes and textures. If a child misses that window between 7 and 18 months old, doesn't mean that all hope is lost. It just means that that child is going to be a little bit behind their peers when it comes to developing oral motor skills, and that's okay. So when we're feeding a child, we need to keep in mind that maybe their skills are just a little bit behind. At the end of the day, elimination diets have to be as varied as possible so that we're giving the child the most opportunity that is safe to be able to learn to like new flavors and new textures. So I really liked this graph. And you can see the slide, the reference at the bottom of the slide, because it's important to see when you look at the age and months, what skills are supposed to be developed and when. And of course, this is not a black and white sort of situation. It's not that all children are going to learn this by a certain time or else, and they're never going to learn it. No, that's not the case. So it just like to point out that in some cases, when we're concerned about how a child is developing feeding skills, it could be that they are right on track with their peers. So this is informational from that perspective as well. Again, parents of children with food allergy have so much pressure on them. I'm hoping this slide may help take some pressure off of some of you that may be watching this video to help you understand maybe where your child is and that your child may be developing absolutely normally. So you can see the child feeds themselves with a spoon without spilling too much, that the vast majority of children don't accomplish that until about 2 years old. Most children are able to grasp food with their hands and engage in some self-feeding by the time they're 8 months old. A child eats food that requires chewing, and I hear this a lot, that a lot of children, a lot of toddlers especially, don't like to eat proteins, especially from animal foods. Well, I mean, that requires a lot of chewing. Those foods can be very hard to chew, and so you're going to see that most children aren't interested in doing that till about 18 months old, but it's perfectly common to hear of a 2-year-old that doesn't want to eat a lot of chicken, for example, because it's kind of chewy, and especially if that chicken's kind of dry. If that food's just difficult to eat, the child's not going to be all that interested in eating it. So think about where your child is with some of these skills, and keeping in mind that it's a spectrum. There are curves, reasons for that. Some children are going to develop some of these skills earlier. Some of them are going to develop them a little bit later. That's okay. There's always opportunity to learn these skills. So how do children learn to like new foods? Well, there needs to be repeated exposures of ingesting foods that do not lead to negative consequences. So when we're talking about wanting to encourage food-seeking behavior, it's really important that we provide children an opportunity to just feel safe and feel comfortable with foods. And for a period of time, if that means that we're only providing a short list of foods, okay, then that's what we're doing. But if by providing that short list of foods for a period of time, we're helping children get confidence that food isn't going to hurt them, that's a wonderful thing. So by the time that children are 5 or 6 years old, they really have learned a great deal about the purpose of eating, about specific food preferences. Taste and taste exposures are more important than visual experiences. The food does need to look good, however, though, because if the food doesn't look appetizing, then it's going to be difficult for anybody, quite frankly, not just a child, to want to bring their food to their mouth. So yes, while taste and taste exposure is important, we can't not think about visuals. Parents need to provide repeated exposures, and be good role models to help children like to learn new foods. So that means that parents need to eat the food that they're asking the children to eat, so that the food that the children are eating, there's not something that's quote unquote different about it, and that it's acceptable by everybody in the home. Children are ready to learn about culture and about food preferred by adults that take care of them. And they have this amazing availability to learn and accept a wide range of foods. Children, they're clean slates, they're open books. They really, so if we have certain foods that the child can't eat because of the food allergy, then we need to think about all of the foods that the child can eat and just give children low pressure, repeated exposures to those foods. Parents often stop introducing new foods very quickly and assume that the child will not eat it. So we'll talk about that too in a few more minutes. So we just want to repeat exposures in a low pressure fashion to help children learn to like new foods. So what happens to eating skills in food allergy? We looked at that chart that said that there's, typically by certain ages, children have developed certain skills, but we need to keep in mind that modifying an infant diet can have an effect that can last between 7 and 10 years. And this statistic is a little bit surprising because if you're saying, well, what do you mean? I mean, so I modified the infant diet, but we were fine. So it means that children remember, and we maybe think that they don't remember, but they do remember. And so modifying the diet up, it's important to remember that modifying the diet can have downstream effects for quite a long time. And we've, again, and there are the number of symptoms that the child experienced during the adverse reaction to the food correlated with the worsening of maladaptive feeding behavior. So if a child experiences multiple symptoms as a result of the food allergy, then we can expect that their maladaptive behaviors are going to be a little bit worse. So it's also important to remember that the feeding difficulties can persist long after the diet's been sorted, and we know the long list of safe foods. We have our list of foods that need to be avoided. So even though there is a major improvement in management of the food allergy because of the fear that we talked about earlier, because of the pain, the feeding difficulties may persist. And they need to be investigated. So, and we already talked about the fact that the choking event can be traumatic. So even if the choking event had nothing to do with the food allergy, if a child chokes on a piece of food, that could just lead to a traumatic event, and that can make it difficult for the child to want to eat that food again. So if you, again, the second bullet, feeding difficulties can be a sign of a larger problem, such as a food allergy. I put that in there because, as you are talking with other friends, as you are around other children that may have feeding difficulties, it's important that we look at feeding difficulties and investigate those, because the feeding difficulties actually could be the first sign of a food allergy. And for those of you that are in the FPIES community, you have the potential to be wonderful advocates for other children out there that may be late to be diagnosed with a food allergy. So fear of food and having an allergic reaction is very real. That fear is going to be demonstrated by the children. Fear can also be demonstrated by the parents. Absolutely. If you had a 6-month-old baby that you rode in an ambulance to a hospital with, due to a severe FPIES reaction, I would not blame a parent in the slightest for being very wary of wanting to introduce new food. So that fear may be keeping the parent or maybe keeping the child from expanding the diet and learning to like new food. So some other intervention may be necessary. So there may need to be a behavioral therapist on board that specializes in food-related issues. A registered dietitian that specializes in food allergy is definitely going to be very helpful. Speech language pathologist or an occupational therapist that specializes in eating issues can also help, especially if there's some issues with textural issues, or if a child was just not able to learn self-eating skills at a certain age and they're learning self-eating skills at an older age. An occupational therapist, for example, can be somebody that can help with that. The good news is anxiety can be lowered. Happiness with food is possible. So let's talk about some other things that we can do to help with that happiness of food and encouraging food seeking behavior. And this is where the division of responsibility comes into play. I mentioned at the top of the presentation that I'm a faculty member of the Ellen Satter Institute, and I teach the division of responsibility in feeding to a lot of families, those that are managing food allergy, those that aren't. I also use it in my own home with my 3 children and have found it to be quite successful. So, in a nutshell, the division of responsibility states that parents or caregivers, their job is feeding. So, the parent or the caregiver decides what food is served, when it's served, where it's served. So, is it some sandwiches on a picnic blanket at a park at 12:30 on a Sunday afternoon? Maybe. The children decide what food they're going to eat. So from the food that's being served, they're going to look at all the food that's being served and they're going to decide what food they're going to eat. They're going to decide if they're going to eat any of that food. So the parents or the caregivers, their job is to provide the food. The child's job is to decide if they're going to eat that food and how much of that food they're going to eat. If parents do their job with feeding, kids will do their job with eating. So how do you implement SDOR in your home? Well, it starts with having more or less a consistent schedule. Having structure to meals and snacks is helpful for a wide variety of reasons, and especially when you're trying to change how feeding is going in the home, having a consistent schedule is really going to help because then children know what to expect. Meals are at the table. They could be at a park. They could be at a carpet picnic in the living room. They could be at a restaurant, but there are no screens. We're not interested in distracting children and making them disconnect with their food. We want children to tune into their food. We want children to tune into their bodies. So we don't want screens to allow them to just disconnect with their food. Everyone at the table is offered the same food. Now, this is tricky because we're talking about food allergy. So there are going to be some meals where all of the food served is going to be safe for the entire family. There may be some meals where there's going to be some food that is served that is not safe for 1 or 2 family members because of the food allergy. And that's okay too, because if we have one child with food allergy and one child that doesn't have any food allergy, we need to protect the child that doesn't have food allergy as well and make sure that that child is learning to like a wide variety of foods. But for the child that's on the restricted diet, it's important that that child sees that other family members are eating their food, even if that's Dum Dum lollipops or popsicles or some slushies. You know, if we're to the point where the diet is really limited right now because we're still sorting the problematic foods, okay then. So let's all eat some Dum Dum lollipops over dinner so that the child sees everybody eating the same food, because once the diet is sorted, this is what's going to help the child learn to like new foods as they get older. So are you having family meals right now? And if you're not, why aren't you having family meals? Is the schedule very chaotic? Is everybody in the house on a different diet, meaning you've got 1 or 2 family members that are on a restricted diet from food? Do you have somebody that's on a restricted calorie diet? Do you have somebody that wants to be vegan or somebody that wants to follow a paleo diet? Does anybody in the house like to cook? Do you have the opportunity and the availability to cook? Are you planning meals, or do you feel like there's no time to plan meals? But let's remember that family meals can provide stability. Family meals can provide so much education about food, about table manners, about being polite. I mean, there's so much education that's provided over a family meal. And most importantly, family meals provide connection for the whole family. So especially if the schedule is really chaotic, if you have the opportunity to sit down together as a family and eat, even if it's not every day, that's going to soon become really treasured time for you as the parent, but then also for your child. So what is a meal? Some people say, well, family meals, I don't have time to roast chicken and then cook the broccoli and the rice. Okay, roast chicken with broccoli and rice, that's a great meal. But a meal, think about it, is just time set aside for the family to gather and feed themselves. Any food is served, and a meal doesn't have to be, traditional meal foods. You know, Life happens, and let's say you had plan A, and plan A was going to be this great meal, and then life happened, and let's say plan B is at dinner some cheese cubes, some popcorn, some grapes, and then we're drinking some milk. I would say, congratulations, you fed yourself dinner and you all sat down and you enjoyed it together. So let's reduce those barriers. Remember, any food is served, safe food is served. And it can be at like we already said, at a park, at home, at a restaurant. And we want children and adults to eat until they're pleasantly satisfied. And the conversation is pleasant. So we're not talking about who is eating, who is not eating. This is not the time to talk about grades or report cards, or this is not a time to start talking about other things that are going on that may be problematic. So we want to keep meals as pleasant as possible. So if you're serving allergenic food at the same meal, you want to make sure it doesn't have any cross contact with the non-allergenic food. So it's a good idea to always cook the food that's non-allergenic first, cover it, set it aside, then go ahead and then start cooking the allergenic food. But remember, this is a good opportunity if the child is old enough to practice asking what is in the food, not taking food from somebody else's plate, making sure they're using dedicated serving utensils. So again, this is for the child that's old enough to start practicing these skills. Children need to demonstrate to their parents or their caregivers that they can safely navigate a table of food, especially when they're not, at home. And so sometimes serving allergenic food with the non-allergenic food at home can be a great way to teach children as they're old enough, so that's the caveat, as they're old enough, as age appropriate, to learn how to keep themselves safe. And that's very important. So we want to talk about our day. We want to talk about upcoming plans that we have. The holidays are coming. It's still a pandemic. Are you traveling? Are you not traveling? Is any family coming to see you? Talk about Halloween costumes. You get the idea. You want to just enjoy your time together. But what we don't want to do is we don't want to ask the child to take one more bite. We don't want to acknowledge that the child or any child at the table is or is not eating certain foods. But we also don't want to let the older child, hold the parents hostage in the kitchen either. What does that mean? Is that we're being considerate to the child, but we're not catering to the child. And so the children need to learn to understand that the food that's being served is the food that's being served. And if they choose not to eat it, that is their choice. And then there'll be more food served at the next meal or the next snack. It's important that parents learn to accept no for an answer. It really is. If a child just says, no, I don't want to eat that food, they have made their decision. And if they end up hungry in a little bit, then maybe they have to stay hungry until the next snack is offered. Maybe they stay hungry till the next morning. I mean, that's up to that's up to parents. That's depending on what's going on in your house. But if a child says no, I don't want to eat that food, parents need to learn to accept no as an answer. Now, children have to be polite about it, of course, but trust is the foundation of SDOR. It's really important that children learn how to trust their instincts. And if a child says, I'm full, and a parent says, no, you're not, finish the food on your plate, or if a child says, no, I really don't want to eat that, and then we're going to force feed that, then what we're teaching children is that they cannot be trusted. And we don't want to do that. Then we're teaching children they can't trust their instincts, that they don't know how to stay tuned in with their body. And that's not what we want them to do. So we want children to learn to trust their bodies, and we want parents to feel comfortable trusting their child's own instincts, because it's those instincts that are going to help keep them safe. So if you are really struggling with feeding your child, please seek help as quickly as possible. This can be very tricky, I'm not going to lie. Depending on where you are, it can be difficult to find help for feeding difficulties for children with food allergy. Um, there's just a special set of circumstances for children with food allergy, some traumatic events. So the FPIES Foundation, other patient advocacy groups really are a great place to go to try to help sort specialists in different areas. Parents should not hide vegetables or other foods that are seen lacking in other foods. A child needs to see the vegetable, for example. They need to taste it, touch it, smell it. They need to know what that food looks like. And if parents start hiding foods in other foods, then this is going to break the trust between the child and the caregiver. But parents should not assume that the child will eat when they get hungry enough. And fear is real. And that fear is going to override instincts. And so if fear is overriding that child's instincts, and of course, yes, that's when we need to start looking at maybe behavioral therapy or some other interventions to help reduce the fear around food so that the child is going to be interested in seeking out new behavior. It's important that parents remain neutral during feeding times. We need to tolerate an age-appropriate mess. And then we need to not use pressure language. What's pressure language? You have to take a no thank you bite. Are you sure you're full? Well, don't you want to eat one more bite? Well, you asked for that and I made that for you, and now you don't want to eat that? That's all pressure language. If you are using language with your children with the goal to get them to eat when they say that they don't want to, that's pressure language. Even with a limited number of safe foods, foods can be served at different temperatures, and then foods can be served with different textures as well. So this is the time to be thinking about ways to make foods thicker, thinner, maybe put them in the freezer into a semi-frozen and get them semi-frozen. There are ways that you can make your own meltable solids. So there's some wonderful ways that you can take safe food and give children experiences with temperatures and textures and flavors, which is going to help promote their ability to learn to like new foods as they get older. And we need to think about too that sometimes eating is not about nutrition. Think about the family meal and the fact that family meal is about connection with the family. And eating is learning, how to sit and behave at the table. It's practicing with new flavors and textures. So nutritional supplements can be used to help fill the gaps in the diet while the child learns to expand their tastes at their own pace. So if we have got some significant fear and anxiety that are preventing the child from listening to their instincts and preventing them from being able to seek out new foods, then absolutely, let's use some supplements to fill those gaps while we work on the behavioral component. Do you want to make sure that we're limiting mealtime to 20 to 30 minutes? If even 20 minutes right now is a stretch and you're not going to have a child that's going to sit that long before they start really getting irritable, then maybe you're only limiting mealtime right now to 5 minutes. And then as the child becomes more relaxed around the table, then maybe you can bring it up to 10 minutes or 15 minutes. But we don't want the child to sit at the table for very. If you are removing more than one food group, you may need to supplement your child. The child may need to be getting additional calories, proteins, vitamins, or minerals from a supplement. It's important that you find something to replace the food that is being removed. So we don't just want to remove food, remove. We need to figure out what we're going to replace it with. We need to find food that brings joy and happiness. This is what's going to help promote food-seeking behavior later in life as well. So that's the good news. There's lots of supplements that are available that can help fill in those gaps. So if you are using an amino acid formula, or maybe some other type of formula to help fill in those nutritional gaps. Work with your registered dietitian to determine how much is needed, because we need to make sure that we're not getting too much of certain things and not enough of other things. Manufacturer websites are usually good sources of information and ideas for recipes to help add variety in the flavor. You can often freeze these formulas and turn them into popsicles, so that's nice, or the semi-frozen solids to help add variety in temperature and texture. Maybe provide the formula at snack time, because if the child is old enough to eat solid food and there's a fair amount of solid food that they're eating, we do want to offer food first, and we want to offer those formulas maybe in between meals at snack time. And I get that these formulas are expensive, so that we're not going to want to see, we don't want family members to be drinking a lot of this. Some of you may be wrinkling up your nose when I make the suggestion to drink some of these formulas as well. But if the child sees other members of their family drinking the formula, then it's going to help make this more normal. It's going to normalize it, normalize the food, make it just food, make it just a drink, not make it just quote unquote theirs. And it may help them accept it more readily. But I get it, this is expensive. The prescription is not for everybody in the family, it's just for the child. But from time to time, if the child sees other family members drinking their formula, this can help keep them on board with drinking what they need to drink to help support growth. Keep in mind that the growth chart is not the parent report card. Please, parents, don't use this as a way to beat yourself up. Children need to stay on their curve, whatever their curve is. Not every child is going to be on the 50th percentile. Growth acceleration or deceleration should be investigated closely before making assumptions. Maybe the child wasn't measured correctly. Children will eat the right amount for them, so they maintain growth that is right for them, especially if they're given enough. So what are some goals? We want to encourage food seeking behavior instead of food avoidance. We want a child that knows how to self-regulate. They eat the right amount of food for them. They feel good about food. They trust food, and they have those strong instincts that are so important, because that's going to help keep them safe. Especially when they're outside of the home, if they're with a different caregiver than their usual caregiver, that trust and those strong instincts is really what's going to help keep them safe. To find a registered dietitian that specializes in food allergy, FPIES Foundation, and then you can see some of those other food allergy foundations, or the American Academy of Allergy, Asthma, and Immunology, the American College of Asthma, Allergy, and Immunology. These organizations can help you find a registered dietitian that specializes in food allergy. So in summary, we want to feed your child like any child without food allergy. Be cautious, but be courageous when trying to introduce new foods. Know when to call for help. That's with the feeding difficulties. That's with if your child starts, having an adverse reaction to the food. Absolutely know when to call for help. Please call for help if you need some more support. And make sure that you inform everybody that's around your child about what's going on with the food allergies, and just let everybody know what's going on, so that you don't have well-intentioned, well-meaning adults potentially give your child food that's not safe, but then also you don't want well-intentioned, well-meaning adults to end up putting pressure on your child to eat, when in fact maybe you're working on the division of responsibility in feeding, and what they're doing is in fact putting more pressure on them, and may make it more difficult for you to progress forward with SDOR in your own home. As a parent, are you having a hard time letting go? And it's understandable. The fear of food is real. We want to keep interactions between you, your food allergic child, and food. They need to be positive. And parents need to learn to trust their child's instinct on eating. Of course, and if you're going to force your child to eat, it's not going to work, and is in fact going to create more behavioral problems. So in summary, eating is not about pressure. It's about shared control. And so we want our children to know that they have an ability to express their opinions about food. And we want children to know that they can say no, thank you, and that they're not going to be pressured into eating something that maybe is not safe for them or just tastes kind of funny. So thank you all very much for listening to this presentation. I hope you've enjoyed it. I hope it's given you some good tips. And for more information on the Ellen Satter Institute and the Division of Responsibility in Feeding, you may visit the Ellen Satter Institute website at ellensatterinstitute.org. Thank you.